Hello, my name's Bob Monroe. I'm a urologist with Palmetto Greenville Urology. I decided to be a physician for certain when I was in college. I was leaning that way, but at some point in college I decided I wanted to be a doctor and went to medical school, and then I decided to specialize in urology because I liked the idea of doing a surgical subspecialty, and I like urology because you get to treat all different types of patients. You treat adults and children, men and women, and you treat patients with medication, or you can treat them with surgery. And I just sort of like the exposure to all different types of patients. We see patients who occasionally have an uncertain diagnosis. They may think they have a life-threatening condition, and we can help them diagnose if they, for instance, have cancer, and help them make the right choices, help them make an informed decision. And if they choose to have their cancer treated, help them be cured from that. So that's obviously very rewarding. One thing I think I try to do is we can say it's unique, but it's one of the things I put an importance on, is trying to communicate with the patient. And I try to, if a patient has a question, to communicate with them very soon. Obviously, if they call the office and they have a question, we try to get back to them that day. And I like to make sure that they know all of the pros and cons of a treatment plan before they leave the office, and I encourage them to call me if they get home and they have a question, and I can call them back and talk to them. I like working with Bon Secours St. Francis. They have an outstanding medical staff, and we can't do it alone. We like to work with other specialists. I like the mission of St. Francis. Obviously, I've been working at St. Francis for a long time, and I think that their approach to treating patients with compassion and respect, obviously, I agree with.